Hey everyone, Dr. Mike here. Today we're diving deep into a topic that affects millions worldwide: post-traumatic stress disorder, or PTSD. Now, when most people think of PTSD, they think of flashbacks and nightmares, often associated with veterans and first responders. While that's certainly a part of it, PTSD is a much more complex condition with various forms that can manifest in different ways. Understanding the nuances of these different types is crucial for providing appropriate support, treatment, and most importantly, recognizing the signs in ourselves and our loved ones. Over the next few minutes, we'll break down some of the most common types of PTSD, exploring their unique symptoms, causes, and potential treatments. Let's get started. Before we delve into the long-term effects of PTSD, it's crucial to understand how it can initially manifest. Acute stress disorder, or ASD, is a condition that can develop shortly after a traumatic event. This isn't just feeling a bit shaken up, we're talking about experiencing intense emotional distress, often with dissociative symptoms. Imagine feeling like you're outside your own body, watching events unfold as if they were happening to someone else. That's dissociation, a common symptom of ASD. You might also experience intrusive memories, nightmares, or flashbacks, constantly reliving the trauma. Avoidance is another hallmark of ASD. You might find yourself steering clear of people, places, or even thoughts that remind you of the traumatic event. This avoidance, while seemingly protective, can actually worsen symptoms in the long run. The good news is that ASD is often a temporary response. With proper support and early intervention, many people can recover fully and avoid developing long-term PTSD. However, it's important to recognize the signs and seek professional help if you or someone you love is struggling after a traumatic experience. While some individuals recover from trauma relatively quickly, others experience lasting effects that can persist for months, years, or even decades. This is known as chronic PTSD. Unlike acute stress disorder, which typically resolves within a month, chronic PTSD embeds itself into your life, affecting your thoughts, feelings, and behaviors in profound ways.
One of the most debilitating aspects of chronic PTSD is the constant feeling of being on edge. Imagine living with a hyperactive fight-or-flight response, always anticipating danger even when you're safe. This can lead to irritability, difficulty concentrating, and problems with sleep.
The triggers for chronic PTSD can vary greatly from person to person. For some, it might be a specific sound, smell, or sight that evokes memories of the trauma. For others, it might be anniversaries or certain times of year. These triggers can send you spiraling back to the traumatic event, making it feel like it's happening all over again.
Living with chronic PTSD can feel incredibly isolating. You might withdraw from loved ones, struggle to maintain relationships, or find it difficult to engage in activities you once enjoyed. The weight of the trauma can feel all-consuming, making it challenging to find joy or hope.
Complex PTSD, or CPTSD, often stems from prolonged exposure to trauma such as childhood abuse, neglect, or domestic violence. This type of trauma is not just a one-time event but a series of distressing experiences that can leave deep, lasting scars on an individual's psyche.
Imagine enduring years of emotional, physical, or sexual abuse, living in a constant state of fear and uncertainty. This relentless exposure to trauma can fundamentally alter the way you perceive the world and interact with others.
This type of chronic trauma can have a devastating impact on a person's sense of self and their ability to form healthy relationships. The trauma can erode your self-esteem and make it difficult to trust others, leading to a life of isolation and loneliness.
One of the hallmarks of CPTSD is a distorted self-image. Years of abuse can lead to feelings of worthlessness, shame, and guilt. These feelings can become so ingrained that they shape your entire identity, making it hard to see yourself in a positive light. You might struggle to see your own value or believe that you deserve love and respect. This negative self-perception can be a significant barrier to forming meaningful connections with others.
This negative self-perception can permeate all aspects of your life, impacting your relationships, career choices, and overall well-being. It can make everyday tasks feel insurmountable and leave you feeling stuck in a cycle of despair.
Difficulty regulating emotions is another common symptom of CPTSD. You might experience intense anger, sadness, or anxiety that feels overwhelming and impossible to control. These emotions can come on suddenly and with great intensity, making it hard to manage daily life. These emotional outbursts can be unpredictable and often lead to feelings of shame and isolation. You might find yourself withdrawing from social situations to avoid the embarrassment of an emotional outburst.
Relationships can be particularly challenging for individuals with CPTSD. The trauma you've endured might make it difficult to trust others, set healthy boundaries, or allow yourself to be vulnerable. This can create a barrier to intimacy and make it hard to maintain close relationships.
You might find yourself pushing people away or engaging in self-sabotaging behaviors that ultimately keep you stuck in a cycle of pain. These behaviors can be a way of coping with the trauma, but they often end up causing more harm than good, perpetuating the cycle of suffering.
Comorbid PTSD refers to the presence of PTSD alongside other mental health conditions, such as depression, anxiety disorders, or substance abuse. This combination can complicate the diagnosis and treatment process, making it essential to understand the interplay between these conditions.
Imagine facing the overwhelming weight of PTSD while also battling the debilitating symptoms of another mental health disorder. The emotional and psychological toll can be immense, leaving individuals feeling trapped and hopeless. This can feel like an uphill battle, making it even more challenging to find relief and reclaim your life. The journey to recovery may seem daunting, but understanding the nature of comorbid PTSD is the first step towards healing.
The relationship between PTSD and other mental health conditions is often complex and multifaceted. Each condition can exacerbate the symptoms of the other, creating a vicious cycle that is hard to break without professional intervention.
For example, individuals with PTSD may turn to drugs or alcohol as a way to numb the emotional pain or escape the constant state of hypervigilance. This self-medication can lead to addiction, further complicating the individual's mental health landscape. However, substance abuse only provides temporary relief and ultimately worsens PTSD symptoms in the long run. The cycle of addiction and PTSD can be incredibly difficult to break, requiring comprehensive treatment and support.
Similarly, depression and anxiety are common companions to PTSD. These conditions can feed off each other, creating a pervasive sense of despair and unease. The constant fear, intrusive memories, and emotional dysregulation associated with PTSD can create a breeding ground for these conditions. The interplay of symptoms can make daily life feel unmanageable.
The overlapping symptoms can make it difficult to discern the root cause of your distress, highlighting the importance of seeking professional help for an accurate diagnosis and comprehensive treatment plan. A tailored approach is crucial for effective management.
Treating comorbid PTSD requires a multidisciplinary approach that addresses both the PTSD and any co-occurring disorders. This often involves collaboration among various healthcare providers to ensure a holistic treatment plan.
This might involve a combination of therapy, medication management, and lifestyle changes tailored to your specific needs. Techniques such as cognitive behavioral therapy, mindfulness practices, and support groups can be particularly beneficial. Remember, you don't have to navigate these challenges alone. Support from loved ones, mental health professionals, and peer groups can provide the strength and guidance needed to overcome these hurdles.
Secondary PTSD, also known as compassion fatigue, is a type of PTSD that affects individuals who are repeatedly exposed to the trauma of others. This condition can be just as debilitating as primary PTSD, and it often goes unrecognized and untreated.
This is particularly common among healthcare professionals, first responders, and social workers. These individuals are on the front lines, constantly dealing with the aftermath of traumatic events, and even therapists who work with trauma survivors. They are often the ones who provide the much-needed support and care, but at what cost to their own well-being?
Imagine listening to harrowing stories of abuse, violence, or loss day in and day out. While empathy is a crucial component of these professions, it can also become a heavy burden, or loss day in and day out. While empathy is a crucial component of these professions, it can also become a heavy burden. The emotional weight of constantly being exposed to others' pain can be overwhelming. Constant exposure to trauma can take a toll on your own mental health. Over time, this can lead to symptoms that mirror those of the people you're trying to help.
One of the hallmarks of secondary PTSD is emotional exhaustion. You might feel emotionally drained, as if you have nothing left to give. This can make it difficult to continue providing the level of care that is needed, numb or detached. You may find it hard to connect with others, even those you care about deeply, as if you have nothing left to give. This emotional depletion can spill over into your personal life, affecting your relationships, hobbies, and overall well-being. It can make it difficult to find joy in activities you once loved.
Intrusive thoughts and images are also common in secondary PTSD. You might find yourself replaying traumatic stories you've heard, or witnessing disturbing images in your mind. These can be triggered by seemingly unrelated events or objects, or witnessing disturbing images in your mind. These intrusive thoughts can be persistent and hard to shake, making it difficult to focus on anything else.
These intrusive thoughts can be distressing and difficult to control, leading to anxiety, sleep disturbances, and difficulty concentrating. You might find yourself lying awake at night, unable to quiet your mind.
It's crucial for individuals in helping professions to prioritize their own mental health and seek support when needed. This can include talking to a counselor, practicing mindfulness, or taking regular mental health breaks.
This might involve setting boundaries with work, engaging in self-care practices, and making time for activities that bring you joy and relaxation, and seeking therapy from a trauma-informed professional. Remember, you can't pour from an empty cup. Taking care of yourself is not selfish. It's essential for providing compassionate and effective care to others. By prioritizing your own well-being, you can continue to be a source of strength and support for those who need it most.
We've covered a lot of ground today, from the immediate impact of acute stress disorder to the unique challenges of complex PTSD and secondary PTSD. Remember, PTSD is not a sign of weakness. It's a natural response to an abnormal event. If you see yourself in any of the types of PTSD we discussed, please know that you're not alone, and there is hope for healing. Seeking professional help is crucial for understanding your specific situation and developing a personalized treatment plan. Thank you for joining me today. If you found this video helpful, please give it a thumbs up, subscribe to my channel for more informative content, and share it with anyone who might benefit from this information. Remember, reaching out for help is a sign of strength, and recovery is possible. If you or someone you know is struggling with PTSD, please seek help from a mental health professional.